Welcome everyone to today's webinar, Driving Top-Line Revenue with a High-Performing Front End. On behalf of Becker's Healthcare, welcome and thank you for joining us today. Before we begin, I'm going to walk through a few quick housekeeping instructions. If you have any questions throughout today's webinar, you can type those into the Q&A box you see on your screen. We will have a few poll questions during today's webinar. When you get to the poll, the question will pop up in your slides box and you can submit your answer directly on the screen. Thank you in advance for your participation. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. Lastly, if at any time you have trouble with the audio or video, please try refreshing your browser. You can also submit any technical questions into the Q&A box and we are here to help. At this time, it is my pleasure to introduce our presenter, Paula Churchy. Paula has a degree in Business Administration and Master's in Healthcare Administration with more than 20 years of experience in revenue cycle management. She is a certified professional coder through AAPC, a fellow healthcare financial professional through HFMA, and a fellow certified medical practice executive with the American College of Medical Practice Executives through MGMA. She has a Green Belt Six Sigma certificate from the University of California, Irvine, and a Change Leadership certificate from Cornell University. For the past several years, she has provided consulting services to more than 250 practices, ranging from one doctor specialty practices to large 1,200 physician integrated delivery networks. So without further ado, I will now pass it over to Paula.
Thank you so much, Kelly, and thank you everybody for joining. Very excited to be here. We have great content for you. So let's start with our learning objectives. So first, we are going to be recognizing opportunities to automate the patient registration process with the goal of reducing work queue volumes and prevent denials. We're going to identify how to drive digital patient engagement and boost self-pay collections via intelligent automation. And lastly, we'll discuss how to customize automation to align with claim rules to reduce inaccurate registration data. But before we get into the content, let's go ahead and start with the first survey. I want to know who is in the audience. So which of the following best represents your organization? Are you from 1 to 100 provider medical practice, 101 to 1,000 providers? What about 1,000 plus? Or are you from a hospital, from a vendor side, or other? So please just let me know where you are from. That's always very, very helpful. Okay, I see some coming in. A little more, and let's go through the next question, which is, let's see. Okay, so we have a little bit of everything, 32% from a hospital side. Very helpful. Okay, let's go to the second one, which is, which of the following best represents your role in your organization? Are you a medical provider, a C-level executive, VP, director? Are you a manager or supervisor of the rev cycle process, a hands-on contributor, so doing front-end registration or doing the check-in, doing the checkout, maybe some insurance follow-up, or other? So just let me know a little bit what your role is within your organization. This allowed a little bit more attendees to answer, and then we'll get an idea. Okay, let's see. We have no providers. We have a very good representation from the C-suite and upper management, and we have some hands-on contributors as well. Okay, this is exciting. Well, let's get started. So first, we're going to be talking about kind of like the challenges that we see most commonly in the revenue cycle, specifically in the front end. So number one is volume of denials, and we'll go into the details as to what we're seeing and where are we seeing the denials. Number two has to do with high patient accounts receivable, which usually turn out to be bad debt. And number three, which is compounded by number one and number two, is the fact that we have staffing challenges, right? So not enough people to do the work. So let's start with growing front-end denials that are constantly leading to the write-offs. And this was, what you have in the screen is a national denial trend that was an analysis that was performed by Change Healthcare that included 102 million inpatient and outpatient claims submitted by a range of small, medium, and large healthcare facilities. And in this analysis, you can see we're at 9.5% in 2019 for our denials, and how it climbed to 10% the first quarter of the pandemic, and then it continued an upward trend towards 11% on Q3 of 2020. That is a 23% increase since 2016. And denials have always been a problem for medical practices and hospitals, but COVID really made it difficult for everyone. I am pretty sure you remember the back and forth on how to bill for virtual visits. Should we use the virtual visit codes or the regular E&M codes? Should we use place of service 11 or 2? The rules were all over the place, and claims were being denied left and right. So yeah, that was fun, and we can see in this graph that these challenges were not a product of our imagination. And unfortunately, this trend has continued. You probably saw the poll that MGMA conducted on March of this year, where 69% of the respondents stated that their denials had increased in 2021 compared to 2020. In average, the increase rate was of 17%, but there were 12% of respondents that stated that their denial rates had increased from 21 to 30%. I cannot imagine having that kind of spike when we're talking about denials. And when we're looking at the denial reasons, registration and eligibility really stand out at almost 27%. And although this type of and hospitals, the current labor market is really putting a burden for most of organizations that have poor processes. Think all the insurance changes your organizations have seen due to the Great Resignation, right? Patients moving from one employer to another. And if we categorize the front end, mid-cycle, and then back end type of denials, we can see that almost 50% of these denials are due to front end errors, and in most cases, preventable errors. When we have looked into this a little deeper with different practices and organizations, we have seen that a lot of the reasons for these denials are lack of resources, staff attrition and training. And this then compiles the fact that there are increasing denial backlogs. And in turn, the absence of denial prevention strategies that these organizations have only allows them to address the symptoms and not the cause, which then results in more denial challenges. And the other thing that we see as reasons that are causing these denials is substandard technology. So the lack of workflow optimization and automation, and along with the inadequate investment in analytics and artificial intelligence, just compounds all of these particular issues. And why is all of this important? Because 30% of the claims that are submitted are denied the first time. 60% of them are never worked. So either because resources do not have time, because we have all these backlogs, or because they don't have the knowledge to do it, specifically when we're talking about clinical type of denials. 90% of these denials are preventable, and only 70% of those that are actually appealed are overturned. And it costs about $25 to appeal a claim if we're talking about a medical practice, or $118 if we're talking about hospital appeals. So it is a real financial burden to the organization to have to work with these denials. So let me work through this screen, which is a little busy because it has a lot of information. but it really tells you the financial impact that your organization could have based on the percentage of denials. So if we have the cost of being 25, a success rate of 70%, an average claims per month of 6,000, and an average revenue per claim of $93, just with those parameters, right? If we have a 16% denial rate, that means that 960 claims are being denied. If you're supposed to be getting $93 per claim, you are getting $90,000 denied. However, you appeal them all, so hoping that you appeal them all, and you have a success rate of 70%, you are recuperating 63,000 or recovering 63,000, a difference of $27,000 lost in revenue. The other thing is that it's not only the revenue that is being lost here, is the cost associated with supporting appeals and the staff members that have to do it. And when we know that it's 25, at least for medical practices, 960 being appealed, we're talking about $24,000 just in cost. Paper, the printout of the system, the time of the end user, the stamp if you're mailing it out, and all of that combined is $51,000 on estimated net denial impact on your revenue. Now, of course, if the denial rate happens to be 6% and we go through the entire exercise, we still have some loss, but is $31,000 different from the other one, from scenario number one. So we can see here that the impact, the financial impact of having denials is really profound for organizations. But I think it's also important to call out that there are other less quantifiable ramifications, such as the time that is taken away from your resources to attend the most fruitful needs of the organization, such as engaging with patients, implementing proactive solutions that avoid these preventable denials. Now, before we look at how to solve this particular challenge, let's look at challenge number 2, and it has to do with patient balances. So when we're looking at patient balances, one of the metrics or one of the studies that I really like to follow, and I do this every year, is a study that is conducted by the Kaiser Family Foundation. So every year they identified what are the plans that are being selected by the patients, what are the premiums that the patients are paying, what are the deductibles, and so forth. And in here, you can see the impact of the patient out-of-pocket expenses for healthcare services. And we can see how the premiums just continue to increase, right? So there has been a 78% increase in the average annual worker contribution for family coverage since 2008 compared to 2021. And yes, we're talking about 13 years ago, but unfortunately, this trend has continued. There is still an increase from 2016 to 2021. So patients are really paying more, or as we can see, paying more for their premiums. And unfortunately, they are not only paying more for their premiums, they are also paying more for their deductibles or selecting plans that have higher deductibles. In here we have that the average deductible for 2011 was $747. And in 2021, if we include all covered workers, was $1,434. And when I say all covered workers, and the reason why I'm calling this out is because all of the workers that even don't have a deductible are included with these numbers. They're assigned $0 as a deductible for these particular patients. So what that means is that the average deductible is actually higher among those patients that have a deductible, right? If we remove those, the average is actually higher. And another important stat to call out is that 29% of covered workers are in a plan with a deductible of at least $2,000, which takes me to the next slide. In here, we're looking at the percentage of all covered workers who are in a plan with a deductible that exceeds the $2,000. So you have all the small firms in the dark blue, all the large firms in the light blue, and then you have all firms in orange. And we can see that over the past 5 years, the percentage of covered workers with a general annual deductible of $2,000 or more has grown from 23% to 29%. And why do I bring all these stats? Well, because from a customer's perspective, they have that, their perception is that, 40% of patients have to either borrow, sell something, or are not able to pay if they are faced with a $400 emergency expense. Then we have 56% of these patients not being able to pay for a $1,000 medical bill. And so think about this, right? In the last slide, we were talking about almost 30% of patients enrolling in a deductible plan that has a $2,000 deductible. And here we have that 56% of the respondents on the survey cannot even cover a $1,000 bill. The other thing is that 60% of the patients say their financial situation makes it difficult to pay for medical bills. 79% of them state that affordability is the biggest problem in healthcare, so no surprise here. Higher premiums, higher deductibles. And then 93% of the respondents stated that healthcare is just way too expensive. And this is a challenge because the problem with their perception, the problem with collecting for patients is that it's very costly to collect from them, right? It costs 4 times more to collect from the patient than it does to collect from an insurance company. And we cannot ignore patient balances as we did back in the day when there were like $10 copays, $15 copays, and it was like a lot of professional courtesy. Because in reality, right now, in a lot of organizations, patient balances or patient revenue represents 30% of their practice. And the other thing that is important to call out is that 56% of the patients would consider switching organizations based on their financial experience. So we have to make it very easy-friendly for them to be able to get this information from the patient so they don't leave the practice. So the financial experience for the patient is actually affecting whether or not they stay within the organization. According to a study performed by HFMA in October of 2020, where they were evaluating how the pandemic had affected priorities and consumerism strategies. And they confirmed that organizations were having more challenges collecting from patients. 80% of them were finding it very difficult to collect from the patient. 70% were finding it difficult, and they were sending them to collections or writing them off. And 80% or so stated that they were taking longer to collect from these patients. And these two challenges are compounded by the fact that there are less resources to do the job. So we have consistent staffing and workflow challenges, which then decrease retention and engagement within our practices. So we're seeing it in every industry, and healthcare is not the exception. Staff members are leaving organizations for a variety of reasons. According to an MGMA survey in early 2021, we can see that almost 60% of the respondents stated that their employees were leaving to get a better compensation package. 21% were burnout. 7% actually had retired. And then the other 7%, they were leaving because they had to take care of a family member, or because they wanted to continue working remotely versus coming back to the practice, or they had to relocate because their spouse or partner's job had changed, so they were moving somewhere else. Another thing that is important to call out about this survey that really caught my attention is the fact that it also mentioned that one of the positions that had a very high turnover was the front office, which is specifically important when we're talking about supporting patient satisfaction. Another thing in regards to engagement and the cost of replacing employees. According to a Gallup report, replacing existing workers cost 1/2 to 2 times the employee's annual salary. So assuming an average salary of $50,000, that replacement costs could translate to $25,000 to $100,000 per employee. So it's extremely expensive to replace these staff members. And staffing challenges are further exacerbated by increasing patient volumes. So it's a good thing, right? But according to an MGMA survey that came out in May of this year, they found that 55% of the practices reported their 2022 visit volumes above 2021 levels. And although it's great to have higher numbers for patients, it is not when we're doing all of these jobs of supporting all of these patients with less resources. And unfortunately, the way most revenue cycle management processes related to the front office are managed contributes to most of these challenges. Revenue cycle is saturated with manual flows that frustrates the patient, the staff, and the providers. Patients are asked multiple times for the same information when they are being scheduled, when they show up at the practice, and when they get the bill because the information was not entered correctly months ago into the system. From a staff perspective, they're being forced to multitask to levels that just increase their likelihood of making errors, which then causes the denials that we saw at the beginning of the presentation. And this is then compounded by the fact that most of the information they are collecting happen to be on paper, and then any process after that is manual, although they have very robust and expensive EHR systems to support their processes. And from a provider perspective, all the innate inefficiencies of these systems or workflows result on not getting paid for the services that they have provided. So it's kind of like a lose-lose situation for everybody. So the status quo is just increasing the challenges that we have. So what are organizations doing to solve these challenges? And here are like four things that we have seen across the industry. Some are establishing staffing strategies that include higher salaries, more comprehensive benefits, flexible schedules, or are offering working from home opportunities for those employees that do not work to telecommute. And these solutions have really proven to be effective to address the staff shortages. But as a matter of fact, according to a survey conducted by MGMA, 56 of the respondents shared that raising wages have been the best tactic for them to retain employees. And unfortunately, this strategy alone fosters the industry tendency of addressing current backlogs with adding more human capital, more resources addressing the backlogs and all of that, versus holistically solving the other sources of the problem, which in many cases includes the substandard technologies and the cumbersome manual processes that we were talking about. So that's when we're talking about staffing strategies. The other leaders are buying point solutions to address the different challenges. I have seen organizations that besides their EHR or practice management system, they have eligibility tools, an estimator tool, a patient portal, they have appointment confirmation services. You get the picture. And although all of these solutions really address their intended areas, they tend to not be cohesively integrated with the full revenue cycle ecosystem, and they tend to have features that overlap with each other and tend to create extra downstream work for the staff. Others just said, you know what, forget about the staffing, forget about the technology, I'm just going to outsource processes, some processes, or I'm going to go ahead and outsource my entire revenue cycle to a third-party vendor. And although this tactic works for some organizations, many are left having to retain employees because they have to work complex denials and manage patient collections. So the other reality is that many vendors have that provide these revenue cycle outsourcing services also have enormous amount of manual work and burden, and ultimately impacting the patient financial experience because there is a lack of communication between everybody involved. So when we're talking about these solutions, right, one that is focusing on people, the other one is talking about technology, the other one is talking about processes, we can see that if we are trying to address each pillar individually, it does not support a long-term strategy. So for organizations to fully establish a proactive, patient-centric financial experience that benefits all stakeholders, they have to look at how they can better leverage their resources so they can perform to the top of the license, how they can gather all the data that is needed to submit a claim without using disparate systems, and how to cohesively improve processes that automate repetitive labor-intensive tasks. And this is where intelligent automation comes into play. So it's a solution that supports the elimination of repetitive tasks, streamlines the process, customizes the experience for those involved, allows the staff members and the providers to spend more time in activities that provide value to the patient and the organization, solves for inefficiencies of the current technology, and then really positions the organization for growth versus working on the symptoms of all of their challenges and their current backlogs. So this takes me on how do we, what's automation all about? Like, let's learn a little bit about automation. So in here, we have the foundational elements of intelligent automation. Some of you might be very familiar with this. Some of you, this might be new to these topics. But one of the most known elements of intelligent automation is optical character recognition, or OCR. So we know that they are able to scan an image, they can read what's in the image, and then they can convert this text from these documents and from these pictures into something that is readable. And I also want to comment that it's not the typical OCR that we have seen in the past, but also what we're calling machine vision, right? Which is identifying not what is in a particular pixel on the left-hand side of the screen, but whether or not it happens to move around. So it's identifying where that information might be. So that has to do with the scanning of the information that you have from an image or from a document. Then is the concept of understanding what is in that image. So that's where natural language processing comes into play. And it's really contextualizing anything that you have seen and being able to take action of it. So extracting the information and said, okay, here is the insurance ID. We need the group ID. We have a copay of $25 for this patient. So it's really understanding what's on the card. Not only the image and the text that's in it, but understanding what that represents. The other component that goes with it is robotic process automation, which is truly the process in which we are automated what a human being could do. So we are definitely mimicking or emulating the actions of a human with the system. So we're taking the insurance card, we're using OCR, we're scanning the information, we're using natural language processing to understand what's on the car, and then we're taking robotic process automation to take the information from the car and automatically upload it into the EHR or into the PM. And then we have machine learning. So another component or another element that is key for intelligent automation, and it's really the concept of becoming smarter as we go through this process. The more data that is processed, the smarter their system becomes. And the other thing is, for example, if we have 100 Blue Cross cards that have been received, and we have identified that 10% of the time we're changing one of those insurances to select something else, the system is learning these changes that are occurring and then avoiding those kind of errors moving forward. So the machine just becomes more intelligent as more data is being processed. So with that, let's think about what could be automated, right? Specifically in the front end. And why am I talking about the front end is because are they repetitive tasks in the back end? Yes, there are. But I guarantee you, if you were to ask your back end resources where 80% of their challenges come from, they are going to tell you they come from the front. So addressing front-end processes will get you faster and more substantial results. And areas that you can improve, we're talking about the intake process. So getting all of the patient registration, the insurance card, capturing that information, automatically uploading into the system, and kind of like removing that human element that really makes errors as they are typing this information will be very beneficial. The other thing is capturing clinical information, so allergies for the patient, things that they can enter into their mobile device or online, and all of that actually being translated into the EHR or PM versus having someone manually enter it. Other area is authorizations. So authorizations has been a big topic in the industry. Is a big burden for medical practices. A lot of them even have to review all of the appointments to determine which ones need authorization. So that's another area that is ripe for automation. Scheduling, and when I want to call out about scheduling is outbound scheduling from referrals and orders. And the reason for that is because a lot of these referrals come sometimes in a fax, or through email, or is just downloading the EHR, and they all go into a work queue and is addressed as time allows, and usually time does not allow. So imagine the beauty of having the system go through all of these referrals, all of these orders, and automatically reaching out to patients to schedule them. So talking about a way to increase revenue by identifying more patients that need to be seen by the practice. That is also tied with care gap chart scrubbing in the area of population health. And lastly, in referrals. So all of these are areas within the revenue cycle in the front end that could be automated to facilitate different processes. So just a curiosity question. Of those that are in the audience, how many of you are currently using automation? So some of you might completely be using automation, some of them are not. Some of you might be working with a vendor to do so, or might not be considering at this time. So let's see what we get. Where are you in the process of implementing automation? I see some responses coming in. Let's allow some more respondents. Okay. Let's see what we have. Okay, so an even split. 31-31 between the yes and no's. And we have a third currently working with a vendor. Good things is that nobody, at least everybody's considering something. I'm very curious to what the other is. So with that, what process are you actually automating? Using the administrative tasks in the front end? Is it clinical? So kind of like capturing allergies or current medications? Or is it the back end, right? There's still opportunity in the back end, but I truly believe, and in the ideal world, right? If the front end of all of the challenges that we have in the front end, if they're all addressed, at some point we might not need as many resources in the back end. Okay, what do we have? Look at that. So for the most part, the processes being addressed are in the back end. So ideally, what I'm really thinking is that we improve the front end, which is where a lot of the errors might occur. So we don't have to even automate the back end, but I can understand where the back end is being automated. Claim status being a perfect example for this. So for those of you that are not automating right now, or that are working with somebody to get the automation going, let's talk about how we can improve this front end process and increase your revenue by leveraging the DMAIC framework. So DMAIC refers to a data-driven improvement cycle that is utilized to improve, automize, and stabilize business processes and designs. The core tools is a core tool utilized for the Six Sigma projects. And the beautiful thing about this tool is that all of the phases contains tasks and tools that will lead the team to find an eventual solution. And although the phases are sequential, like you see here, define, measure, analyze, improve, control, they are not strictly linear. So let's get a quick look as to how this methodology would work when you go down this path of automating processes. First step is to define. So what is the problem that you have? What is it that you are seeing? What is it that you want to see? You need to document your workflows, brainstorm what kind of desired outcomes you want to have. Once you have that, then you go to the measure state. And in here, you're quantifying the problem. So you can conduct surveys, obtain the current performance indicators, and you're really confirming whether or not your concerns are valid. Then you analyze the data. Why is this happening? What can we do about it? And you select some solutions, like, for example, automating your front-end processes. Then you go into the improve. So this is kind of like the implementation step, where you are implementing, you are verifying the solution works, you are making modifications, You are tracking progress until you get to the control phase when you're just maintaining the changes, you're celebrating your success, and you continue this loop of continuous improvement. So let's see how this tool can be leveraged to discuss the problems and the challenges that we're facing in the revenue cycle. So first, defining the problem, right? So we have high denials, staff shortages, high uncollectible amounts. Start thinking about what can we do about it? Is this truly a problem of ours? What are we seeing? What can the business do to automate some of these processes to make it easier for everybody? And document your workflow. So when we're talking about documenting your workflow, make sure that you are looking at every single process of the intake process. Anything that is taken to complete the task. The most common workflows that I see are either completely manual or partially manual and supported by a point solution. So if we talk about a fully manual process, the team captures basic information during the scheduling process and usually leaves every other task to be finalized when the patient shows up for the appointment. This is when we see the 20 minutes registration process when the patient comes in. This is also the problem that increases the risk of having the staff members making data entry mistakes because they're trying to get rid of the line that they might have standing in front of them. And you might also have the risk of providers getting tired waiting for the patients and they come and grab them from the waiting room and they don't even finish the registration process. So that's one of the workflows that I have seen. The other workflow that is also very common is the one where there is some manual intervention and there is point of service solutions being utilized. So the basic information is collected during the scheduling process. An email or text is sent out to the patient to log into a patient portal to pre-register. The check-in process for these patients is somewhat streamlined because the portals capture all this information up front. But unfortunately, not all of the data elements that are captured are automatically uploaded into the PM or the EHR. So the end users are having to manually enter this information, which is room for error. And the other component is that not every patient is using patient portals. So adoption isn't very high. The study that I recently saw is somewhere in between the 40% adoption from a patient portal standpoint. So there is still a lot. What that means is that then it's leaving the patients to register when they check in and having the front resources go through the very manual process that I just described. So make sure that you are documenting every single step in the process. The other thing, once you document the process and you're saying, okay, here are the areas in which I can improve, is measure and review your current KPIs. So what can you be looking at? Be looking at the days in AR, which should be somewhere around 31 days, depending on your payer mix. The AR over 120, ideally less than 10%. When we're talking about your net collection rate, ideally higher than 98%. Your denial rates, this is going to be very telling for you. Why are your claims being denied? Where are the errors happening? Ideally below 5%. Your first pass resolution rate at 95 or above. And then when we're talking about first pass rate at 98 or above. So get a baseline, get a qualitative baseline of where you are with the KPIs. And the other kind of metrics that I would like for you to review if you're not doing it today are the ones listed on the screen. And these are really specific to front end. For example, no-show rates, right? When you are automating processes, when the patients are prompted to check in a very intuitive manner, that should decrease your no-show rates, at least by a 20%. So it's good to have this information available for your projects to see where you are, get the baseline, and track them as you will see in the next steps. And the other thing that I want to call out is that when looking at these metrics, also consider your staffing ratios. In some organizations, I have definitely seen that there are outstanding results, but when you dig deeper, there is a whole army of resources supporting these results. So also identify what your staffing ratios are. Once you know where you are, when you're getting all these baselines and analyzing all these KPIs, analyze the results. What are driving it? You will find that there is plenty of opportunities if you are looking at your denials. Are you having denials because of demographic errors, because of missing authorizations, because you are missing some of the information that is required for the claim? Great tools to leverage in this process to identifying the whys is the 5 whys. Why am I getting denials? Is it because of eligibility? Why am I getting eligibility denials? Because we're not getting the insurance cards. Why are you not getting the insurance cards? So you go down the path of asking the 5 why questions to get to the source of the problem. The other thing that you could use is the Fishbone Diagram, which is kind of like a cause-effect diagram, also known as the Ichikawa diagram, which is very helpful to identify the causes. Don't treat the symptoms, which is what we tend to do in our industry from a rev cycle standpoint. Treat what is causing the denials to begin with. Once you have identified what's causing 80% of your headaches, then you can start brainstorming on what the desired outcome should be. And kind of like make a list of all of the items that will be ideal to collect when you are going through the intake process. So that helps you when you're implementing a tool, right? So you want to capture the demographic information, you want to check eligibility, benefits, obtain the prior auth, all of the different steps that you really want to check the boxes about. So when the patient checks in, you're just really greeting the patient and letting them to take a seat because the provider will be with them shortly. And with that, we want to make sure that we're eliminating all the barriers and the repetitive tasks of the process. So once you have this checklist, look for solutions that eliminate inefficiencies. So imagine a process in which your patient receives a text or an email. They're authenticated securely without having to download an application or having to enter any credentials. The Intuitive platform guides them through the customizable check-in experience. And when I mean customizable is the fact that you are telling the patient, they're identifying the patient, who they are, they're having them verify the data that is already available to you. You're not forcing them to enter all this information over and over again. The insurance cards are scanned if they are not available. The information is extracted. Everything gets uploaded into the system. So there are not manual steps required to enter this information into the system so the claim can go out and the bills can get paid. And when you have all of that, then you're ready to develop the plan, implement the changes, monitor the trends, and really make modifications as you are implementing the changes. You can start with a small pilot. Let's say if you have 100 locations, start with 2 of the locations that perhaps have the highest denial rates, and then you can scale. You can change some of the things that need to be changed because you have identified additional opportunities, and then you can make the modifications and scale it. Some things that I want to call out from a best practice standpoint, and it is the concept of really simplifying the engagement, delivering a customer-grade experience, and not only solving for the patient, but also solving for the providers and the staff. And when we're talking about patients, really think about what the patient wants. You can see on the screen results from different surveys that summarize patients want transparency, they want simplicity, and they want options. When we're talking about transparency, yes, the no surprise bill is pushing this forward for all of us. And from a patient's perspective, I love this initiative. I want to know upfront what my responsibility is going to be. But I also want it to be simple and easy to understand. According to a 2020 Instamed report, 71% of patients were confused for the medical bills, and 30% of these patients delays payments because they didn't understand the responsibility. So any initiative, any process that you are implemented needs to make it easy for the patients to pay you. And finally, they need to have options. And when I'm talking about options is on how they get the bill. So yes, you have the all paper statements, the e-statements and all of that, but keep in mind that according to the Digital Health Wire article on patient engagement, which was published earlier this month, 62% of patients prefer text messages to receive provider communication. So keep that in mind. So from an options perspective, how do we get the bill? And the second part is how do we pay for the bill? So yes, there are still checks being utilized, but the majority of the patients really prefer an electronic payment method, whether it's a credit card or the HSA, or they are using Apple Pay. I even heard a practice at the MGMA Financial Conference in March that was offering cryptocurrency options. So that's a little out there, but I guess the future is here, right? So meeting the patient where they are is going to be very helpful for you to reduce all of those high deductibles that you have or high outstanding balances that you have from the patient. The other thing is making it easy for your patients to engage with your practice. Because if we do something like that, if we increase patient access without app fatigue or portal logins, you are 4 times more likely to increase the pre-registration completion. And 70% of your patients complete your registration process prior to actually coming into the visit. So imagine you're only having to deal with 30% of these patients having to do it manually. The other thing to keep in mind is driving a consumer grade experience, engaging all your patients as if they were Diamond members. I love it when I call Delta Airlines, they pick up if they know who I am. So they're customizing the experience to, hi, Paula, how are you? I noticed that you have a flight coming up. Having that level of customization, knowing about your patient, remembering the patient really provides value to them. And keep in mind that from a consumerism standpoint, the best experience a person might encounter with technology, regardless of where they are encountering it, versus airlines or healthcare or when they are shopping online, whatever the experience they happen to have, they will expect the same from everyone else. So if I can check in online for my flight, I want to be able to check in online for any other kind of engagement. And this just really drives patient satisfaction. And another thing to keep in mind is that, yes, in a lot of instances we're solving from patients, we want to be patient-centric and to have the experience being surrounded around the patient, but we want to make sure that we're also solving for providers and for the staff. And what I mean by that is that identify tools that are going to make it easier for them, that they are going to be able to spend more time delivering care than documenting it. Ideally, you are cutting on clinical intake hours, on patient registration hours. You are collecting more copays. You are saving time doing appointment reminders if you're still doing the appointment reminders over the telephone. So ideally, you are really not only solving for the patient, but you are also solving for the provider and for the staff to strengthen the human connection with their patients. And once we have gone through the steps, right? So we have identified the problem, we have documented what kind of solutions we want to implement, we have generated a plan, we have implemented some of these solutions and identified what kind of best practices do we want to incorporate so we have a sustainable process. The last step is to highlight your outcomes and highlight them in the different areas. So from a front office perspective, you are hopefully identifying that you have a greater number of touchless registrations, that you have eliminated a bunch of unnecessary phone calls, that you have reduced documentation time from the front desk. They're not having to manually enter the information or capture information on paper, that all of that is automated and digitally done for them. That you are doing more authorizations that you did before, or at least on a timely manner. That you have saved time on doing these authorizations. So you can capture all of the different outcomes that you are getting in different areas. And this gives you an idea of what you could expect out of this. The other thing is patient engagement. So another great area for you to call out in the outcomes, that you have increased patient engagement, that you have higher percentage of patients being engaged with your practice, that you are reducing no-show rates. And patient satisfaction is even higher because you are implementing state-of-the-art technology that is making it easier for them to go through the whole financial experience. And when they get to the practice, they're having more of this human connection with your staff members. And the providers are spending more time with the patient face-to-face and delivering care versus documenting what kind of allergies and anything else they might have. And then the back office, right? So I noticed that a lot of you are automating the back office processes, and I expect that you're going to have a reduction in eligibility-based denials and a reduction on write-offs. So these are all great metrics for you to call out as you have implemented this process. And I will say that according to a study that was published in the European Journal of Social Psychology, it takes an average of 66 days for a new behavior to become automatic. So don't stop tracking the progress of your initiative. Keep the momentum going and instill a loop of continuous feedback to improve the outcomes. So yes, you have implemented an automation tool, or you have improved their processes. You have aligned your staff members to do that. But don't stop once the project is completed. Don't let those old habits come back, because humans have great muscle memory, and we revert to old processes very easily. So keep the momentum going. Keep tracking all of the KPIs and how you're doing within the different areas of the revenue cycle, and don't stop there. There is always great opportunity to automate other processes within your organization. I have seen that a lot of organizations really start small. Let's say implementing the check-in process automation tools. And once they get the taste for automation, the whole scope of the project expands, right? Now they want to automate authorizations. They want to automate how they are collecting these payments, the estimates that come with it, how they do the follow-up at the end, how the payments are captured. So it just expands into a greater opportunity. So keep those ideas going as you are implementing the process for more opportunities as you understand the technology. So we have spent the last 50 minutes or so walking through a lot of information. I'm leaving you with 3 key takeaways to drive top line revenue growth. One is to solve the core problem. Don't just treat the symptoms, which is what we tend to do. It's like, hey, we have this backlog of denials. We need 10 more people. Let's get them into our offices. Let's call these insurance companies. Really address the core problem, the manual workflow, and anything that has to do with your denials. Why are they being denied? Look for the reasons and solve for them. The next thing is to implement a cohesive solution. So don't implement a solution that addresses your appointment reminders, and then a solution that addresses your eligibility because you have problems with eligibility, or one that addresses your authorization problems. Try to look for a solution that is cohesive and addresses every challenge that you have within the revenue cycle. And lastly, iterate and scale, right? So I was just talking about the concept of a lot of organizations start small, which is a great place to start. Evaluate the process, identify opportunities to improve, revamp the process that you have utilized for that particular workflow, and then look in other areas to expand the automation tools. And also, if you're starting with one location, then scale to do 100, to do 200 locations, depending on how many you have. And the beauty of this is that you are doing all of this, you are growing patient volume without hiring more staff. Technology is actually supporting you. So I'm going to stop right there to leave some time for questions. So Carl, Kelly, anything that we have in queue?
Thank you so much, Paula, for that fantastic presentation. And as you said, we can now begin today's question and answer session. Please submit any questions you have by typing them into the Q&A box you see on the dashboard. We will try to get through as many as we have time for in the remaining time. I wanted to start off with this question for you, Paula. The question is, what areas of the revenue cycle do you see commonly being automated?
Well, I would say the revenue cycle as a whole is ripe for automation from beginning to end. What I will say, however, is that most organizations are starting to automate the front-end processes because for the most part, this is what is causing 80% of their challenges. This also gives them an opportunity not only to improve their outcomes, but also to engage and retain patients in a more meaningful way. So I would say front-end processes is what are most commonly being automated, Kelly.
Great. And this next question relates to automation as well. One audience member says it seems like the shift to automation is an essential element within the delivery of value-based care, and is asking if operational reliance is automation focused, what is the recovery time for systems sorted by cyber threats, i.e. to automation within care delivery?
Holy smokes, that was a full-blooded question. Would you repeat that again?
Absolutely. So the question is, if operational reliance is automation focused, what is the recovery time for systems thwarted by cyber threats, potentially?
Cyber threats, is that what I'm hearing you here?
Yes, yes. In other words, automation within care.
Well, so I think there are two components there. One is the risk of a cyber attack being driven by automation. I think that's where the question is coming into play. And I would say something. The beauty of the automation tools like RPA, like APIs, is that it's using whatever security parameters you have in place today. Think on the fact that the technology is just mimicking what your resources are doing. They're acting as another employee of your practice. So with that, whatever type of security measures that are being implemented within your organization are the same security measures that are going to be utilized through automation. So there is not a second layer of risk per se coming into play when we're talking about cybersecurity attacks.
Great. Thank you so much. And this, going along those lines of automation too, in that time frame, how long does it take to automate the front end of your revenue cycle?
So it really depends on the practice. It also depends on the type of technology that you have available. But anywhere between 6 to 8 weeks is what we're seeing on the length that it takes to automate processes.
Okay, great. And we also have a question here. Do you recommend having a variety of automation tools to support different areas of the revenue cycle?
So this is inherent to our industry, right? And is the fact that we try to look for solutions that are addressing specific challenges. And part of that is because we're also very silo in the revenue cycle, or in a lot of organizations, the revenue cycle is kind of like siloed. You have front end challenges, you have back office challenges, and they're not sometimes communicating to each other. So the answer to that is really not. You should look for a partner that is able to support all of your automation needs. Do not try to look for one that addresses your authorizations, one that addresses your check-in or clinical intake or registration intake, and one that addresses claim statuses for follow-up or denials for that matter. Try to look for a vendor that is actually addressing all of them for you. So having one solution, one partner that you are working with is what I would say would allow you to really streamline the process.
Thank you. And it looks like we have maybe time for one more question here from an organization says we have tried to take an EHR first approach at our organization, but are starting to see some of the limitations there. So what has been the biggest reason our organizations decide to use automation despite some large EHR investments?
Well, what we've seen is that EHR systems are meant to be the clinical record for the practice. They were not necessarily designed to foster patient engagement, not to make sure the practice got paid in a timely manner. So although most of them offer solutions that addresses these needs, they tend to miss the mark on achieving outcomes like a percentage of patients' population that engage on a digital matter, or reducing denials, or staffing needing to manage patient billing. So that's some of the reasons as to why people are looking for point of service solutions, is because the EHRs and bigger platforms were not meant for this type of engagement. But this is what I would say is why they're also looking for automation. And keep in mind that automation is a solution that sits on top of the EHR. So it's not really affected the type of investments that organizations have made in these large technology stacks. And it sits on the top, and it addresses really the things that are related to workflows and manual processes, something that is innate to the automation process. That's what they do best. So that's why the EHRs are not necessarily going down that path, and they are missing that mark.
Thank you. Well, it looks it looks like that is about all the time we have for today during this time frame, but I want to thank Paul Turchi for an excellent presentation and discussion, and also notable as well for sponsoring today's webinar. Please don't hesitate to reach out with any questions. And thank you again for joining us today, and we hope to see you at future Becker's webinars.
Thank you so much, Kelly. Thank you, everybody.